Public Health Project, Part C. Introduction. Indigenous Australian communities suffering with mental illness, how traditional Chinese medicine can support this socially affected community. Globally, anxiety and depression are serious global public health concerns. 20% of Australians are affected by depression and other mental illnesses each year. A shocking 45% of Australians aged between 16 and 85 are diagnosed with a mental health condition. Extreme, but not rare, suicide can be the outcome of depression, as depression can debilitate a person's physical and mental capacity to function on a day-to-day basis. 3,000 Australians committed suicide in 2017 due to their lack of access in receiving appropriate treatment. So the target population of this project, the rural Indigenous Australian community living with mental illness like depression, are the target population for this project. The dire need for a public health program for the rural Australian communities has been supported by the indisputable evidence showcasing the devastating mental health epidemic that is affecting these communities. Desperation is filled to the boiling point for these communities who need support, with a disproportionate amount of up to 4.3 to 51% of Australian Aboriginal individuals suffering with mental and depressive disorders. Suicide rates are 1.4 to 2.3 times higher in Indigenous Australians than that of non-Indigenous Australians. Studies show that mental health conditions are 2.3 times higher in Indigenous communities than that of non-Indigenous communities. Increased public health services and support are often directed to the metropolitan area, and it's rare that the rural areas see the benefit of these fundings. Barriers to receiving appropriate mental health treatment include affordability, availability, distrust, lack of education around mental illness, and access to effective treatment, plus the difficulties of extreme remote geographical locations. This epidemic stems from their traumatic history of colonization, the stolen generation, distribution of culture and land grabs, loss of identity, and maltreatment. So the purpose of this project is to support the suffering Indigenous Australians with mental illness. Is the purpose of this project offering unconventional and alternative viewpoints in the management of mental health conditions like depression and anxiety via traditional Chinese medicine, TCM. TCM has been used for over a millennia as a natural standalone treatment, but now has officially and clinically been proven effective in enhancing mental function, physical health, and alleviating symptoms of alleviating pathologies. In TCM, the mind is not separate from the body, but work together, ideally in harmony with the emotions and the spirit, to create the whole person. These aspects are all integrally related, and TCM treatment looks at this and cares for all of these aspects. Through physical treatment, the psychological mind will benefit, and vice versa. TCM has the potential to offer invaluable treatment opportunities for Australian Indigenous rural communities with these mental health conditions. TCM is a desired and favourable complementary medicine and therapy to that of mainstream Western medical therapies. as it offers minimal invasive therapy options with few adverse reactions, which is appealing to those who are seeking safe alternative interventions. The barriers for patients to gain access to safe and effective psychological therapy is sparse, and the risk of adverse effects with Western pharmaceuticals is significantly higher than that from acupuncture alone. This study states that 60% of people with depression experience no benefit from prescribed pharmaceutical medication. As a result, mental health is an area in medicine where there remains a large gap of ineffectiveness. Objectives and evaluation of this project. So the first objective is to share with the Indigenous communities an alternative therapy which can provide relief to mental health conditions. Second is to offer a helping hand to a disadvantaged population with a natural therapy proven to alleviate some symptoms of illness. To showcase the benefits of TCM, increasing the reputation and profile of this therapy to the Aboriginal communities. How will we do this? Through working alongside existing health and educational support services providers with a focus on rural communities to help foster trust and engagement with TCM treatment. We will conduct TCM assessments that are individualized for the community members and carry out TCM treatments for mental health. Emotional care will be provided through encouraging the community to express and share their viewpoint on the introduction of TCM in their communities, producing respect and trust for TCM as an ancient form of healing. It will be vital for the public health project to communicate to the Aboriginal communities and people that just like traditional Aboriginal medicine, TCM is also a traditional medicine, with its culture and practice going back thousands of years, just like Aboriginal medicine. Also communicating the clear link between these two with their shared philosophy that men and women should live in harmony with the land, nature and the elements and live by the seasons through diet and activity and lifestyle. By providing workshops and talks regarding the benefits of TCM for mental health, this will help build the awareness within the Aboriginal communities of their potential treatment options and give them hope. We will expect to see a difference within the wide community within a 5-year period. The evaluation plan will be utilized to gain precious information into the effectiveness that acupuncture treatment has on mental health and Aboriginal living in rural communities. To evaluate the project, follow-up measures on a monthly basis over a 6-monthly durational period, as well as follow-up treatments after 12 months of the initial treatment.